Nearly half of all U.S. adults suffers from high blood pressure or hypertension, sometimes called the silent killer. There are usually no obvious symptoms or warning signs that something is wrong until it's too late. Doctors say the best way to protect yourself is knowing your risk and knowing your numbers. Here to share more on risk factors and prevention is Dr. Maria Delgado, hypertension specialist with the University of Miami Health System, and her patient, Jorge Salazar. Thanks to both of you for being here.
Hi.
Hi.
So it is Heart Month. So doctor, let's talk about what it is that we need to know. And you and I were just talking about how women still kind of fall off the radar and think they need to worry more about their breast cancer health or gynecological health than they do their heart, correct?
Yeah, hypertension is actually, as I was telling you before, it's worldwide. It's a population. It grows with us. So if in your family, that's the rule of thumb for everybody. If your family, you have a grandparent, just one, that has hypertension or took medicine for high blood pressure, the likelihood that the rest of the offsprings, at least 50% of them, will become hypertensive. We're talking about the great-grandsons, is very high. And when just one parent is hypertensive, we're talking about 75%. So it's a population.
That's huge. Wait, say that again. I think people need to understand that.
If one of your parents, let's say mom, is hypertensive,
yes,
the likelihood that at least 75% of the offsprings of the kids will become hypertensive in the future is high.
That is high.
And we're talking about not only the family as it is, but also because when you think about hypertension, it stops in you. Okay, I'm hypertensive. Oh, okay, what do I need to do? Hello, look at your kids. Those kids that are 10, 12, 14 needs to start being proactive. Understand what is blood pressure. Understand what are the risk factors that we can actually change. Because right after puberty, when they're young adult, 18, 20 years old, those that have a strong genetic expression will become hypertensive. And we're talking about young people, athletes, that do good diet, don't do drugs, don't do alcohol, do exercise.
They're doing everything right.
But they have the genes.
So if I'm a mom, I am a mom, and I'm watching this and I think, wow, maybe I need to have my children checked. Is that something that the pediatrician should be following up on? Is that, should I take my child to the pediatrician and say, check his or her blood pressure?
Yes.
Okay.
But still, as you mentioned, and it's important because when the new guidelines came about, everybody thought, okay, they just changed the numbers and now everybody's hypertensive. And the understanding of hypertension is not a number. So a number is literally a guide that the physician have to detect hypertension. Hypertension is a vascular disease that actually starts in the womb. So the mom that is hypertensive or have extraordinary genetic risk for hypertension, the baby will already have genetic alterations to say something. And the kids, they start already with what we call vascular dysfunction, meaning that the blood pressure is still normal, but the way the vascular response is abnormal. So it's not a number. When we try to, and what we did, when we decreased the guidelines, it's just to try to
bring awareness.
Capture all the kids, because essentially we're going into the 20s and low 18, 16 that become already in the level that we used to call pre-hypertension, which is called elevated blood pressure.
That's scary.
And why am I saying this? Because even in the community, for the physician, it's hard to understand. So the mom have to be empowering to have the pediatrician understand
to check that.
The blood pressure.
All right, Jorge, let's get to you. Tell us your story. How did you realize that you had hypertension?
Well, taking account the comment from Maria Carolina, both sides, maternal grandmother and paternal grandfather has hypertension, and also died because hypertension complication. But I all the time was a normal blood pressure in my life until one acute episode. I had a pulmonary embolism because complication in my leg 3 years ago, and one of the symptoms was very high blood pressure at that moment.
Wow.
Okay, over 180s.
Oh
okay.
My. Yeah.
After that, I remained in high blood pressure for the rest of the time. Once that episode, we started the evaluation about me, and not only discover the high blood pressure, but also discover consequence about the heart, this high blood pressure.
Yeah.
One consequence was the increase in the mass of my heart.
Wow.
This is LV hypertrophy. And when we start the controls, the diet, the pills, and the schedule of assessment, and after 1.5 years in blood control, very, very well blood pressure control.
Wow.
Now I don't have LV hypertrophy. Now my heart is normal.
That is scary. Thank goodness, though, well, but you had to have that episode to find that out. And so, doctor, you were saying that a lot of people, again, hypertension isn't something that you, I have a pain here, or I have an ache here, and maybe I'm hypertensive. It goes undetected until you have some sort of extraordinary episode, like Jorge, right?
Exactly. So what we see is a lot of young men and women in their early 40s or early 50s that will come to the ER with a heart attack, a stroke, or severe like a headache, which is encephalopathy, or a very extraordinary case like Jorge with acute pulmonary embolism. And it's not until that time that they realize they're hypertensive. So even for the patient, when you ask them later on, so how long have you been hypertensive? Well, since my heart attack 2 years ago. Hello? No.
You had this.
You, at least, if you had a heart attack in 2008, you've been hypertensive for the last 2 decades.
Let's get to the numbers, because if you read up on hypertension, you will see that there are what they might say are new numbers, and you say it's more new parameters, of a blood pressure rate of 120/80. Now that's considered normal, but if you have anything above that, you're considered hypertensive. Am I correct?
Well, now the guidelines change.
Right.
So 120 is already, or 80 is already elevated blood pressure.
Okay.
And again, what it's telling us is that there are kids, there are young adults that with those blood pressure, which almost 100% means that they have history of hypertension in their family, they already have vascular dysfunction. If you leave the natural history to go on, at 18 you have 120/80. If you keep without modifying certain environmental factors, at the age of 30, you will have 130/80. And the hypertension, what I'm trying to tell you, the hypertension disease escalate and progress until an event happens.
Right. So let's talk about your clinic at the University of Miami. What are you doing particularly in that clinic and helping people to either discover they have hypertension or to control it?
Well, one part of first I developed a hypertension clinic at the University of Miami with the idea of trying to not only control hypertension in the already hypertensive population, but also to get into those who are not hypertensive, at least they're not aware. So we're now getting a lot of referral of very young people. Because it's an adult clinic, have to be older than 18, but we have children, well, not children, young adults in their 20s are coming because somehow, some way, they had a blood pressure reading that was a little bit elevated. And when they come here, they will understand, no, this is hypertension. Some of them have to be treated even at an early age.
And change their lifestyle as well. You have to eat right, exercise, all of those things?
Exactly.
Yeah.
And the way I see it, these are your genes. The genes are like this metal. So far to this day, we cannot change the bulk of genes that express hypertension in a person, especially because they're different among peoples and family. But what is around that gene is smoking, for example, drinking, not exercise, high-fat diet. So
obesity, all those things.
So these are environmental factors. Saying this, as an example that I was trying to give you with a young woman, you can be in better health than to be an athlete. So young woman, athlete, super natural diet, no alcohol, no cigarette.
Right, but you're saying if it runs in the family, you've got to take care of it.
So the strong genes are there.
They're there.
They're there.
Jorge, quickly, how are you feeling? How are you doing?
Actually, excellent. Actually, excellent.
Good.
But after that episode, I remains with some headache, some symptoms, in general. But now I'm excellent and very well controlled.
Good.
And very active in my life.
And your family too, they're making sure they're checked out as well. Thank you both for being here. We really appreciate it. We hope everybody checks their blood pressure, right? And knows their numbers. Thank you so much.
Thank you.
Okay, thank you. Bye.
We'll have all the information that we discussed today, plus more tips to get heart healthy on our Facebook page at Your South FL.